right, everybody, I'd like to thank you for coming to our second Lunch and Learn of the 2018 series. We're very excited to have you here, and it is our community, and let's make a difference. And today we're going to be talking about neighborhood access to services. It is so important that we share what we do with people so that people know where they can come if they need help of sorts. So please use the information table in the back and take whatever you need to take to share with your colleagues, okay? I have the honor and privilege to introduce our MC for today, and her name is Fran Frazier. Please give her a round of applause because once you hear her, you're going to be amazed. Fran also is one of our community relations commissioners, and she is also the backbone of Rise Sister Rise. So help me to greet her again, and we're going to get started. Thank you.
Thank you, Gail. The other thing that I should mention is that I am a member of the Commission's Education Committee. And it's our committee that, well, with Gail's guidance, thinks of the topics for our Lunch and Learn series. So we're really happy that you're here. And Gail was telling me that we've got a little bit of a following, so we're really happy for those of you who continue to support us. I would like to introduce Commissioner Allison Poirier. Commissioner Poirier, she's in the back, is the chair of our Education and Issues Committee for the Columbus Commission on Community Relations. And Miranda is staff to our City Department of Neighborhoods. I think that's it for right now. Well, this theme we have is really an important theme, right? Let's make a difference. Many of you are probably members of organizations that provide services to our citizens in the city of Columbus. But we also wanted to introduce you to organizations that are literally making a great difference. And let's see, I'm just going to tell you who's on our panel, and then I'm going to ask them to introduce themselves again just by giving you their title and the kind of work that the organization does and what do they do for that organization as well. So Joyce Shivers has wearing two hats today, right? So she's representing the Federation of Settlement Houses, and she's also representing Gladden Community House. David Huey is the Franklinton Pride Center manager, who is, actually we have Pride Centers around the city, and they are under the auspices of the City Department of Neighborhoods. Patti Callahan is with the Central Ohio Area on Aging, and I'm probably needing to know more about that than ever before, Patti. Prem Choksey, is with Celebrate One, and Thomas Fletcher II is with Lower Lights. So let's give our panelists a round of applause. So I'd like for you to introduce yourselves. Tell us a little bit about your organization and exactly what you do for that organization. So, Thomas, do you mind if we start with you?
Sure, that is just fine.
Great.
Hello, everyone. My name is Thomas. I'm with Lower Lights Christian Health Center. We offer comprehensive healthcare services to individuals and families with and without health insurance throughout Central Ohio. Recently, on May 16th, we did open up the nonprofit grocery store at 1160 West Broad Street, the Jubilee Market and Cafe. So we thank you all for your support and your thoughts as we've been working on that just endeavor. It has been a lot of fun, and we're looking forward to seeing where it just continues to go. And my job as the Outreach and Engagement Manager is really to do stuff like this, where I sit on panels, I speak with individuals, I speak with community agency leaders, and I also just go to health fairs and any other sort of informational sessions where I can ensure that people are aware of all the services that we offer. Another hat I wear is also to work with and coordinate all of the volunteers that we have come to LOCHC, where all of our providers and medical professionals are employees. We do have a variety of other volunteer opportunities, which I can talk about later.
Thanks, Thomas.
Good morning, everyone. My name is Prem Choksey, and I work on the Celebrate One initiative as a Director of Community and Legislative Strategies. I see a couple of partners out in the audience today, work very closely with Nadine and Kim. But essentially, we're an initiative in the mayor's office focused on reducing infant mortality. And we don't do it alone. We have many partners across sectors to make this work happen. We are in 8 high-priority neighborhoods, and those are the neighborhoods with the highest infant mortality rates. And as you can imagine, also challenges around what we call the social determinants of health, so the social and economic factors that impact infant mortality, such as access to transportation, safety, access to quality education, that sort of thing. And so I will refer as we move on to our 8 high-priority neighborhoods, but I quickly wanted to just give them a shout-out so you know which neighborhoods I'm referencing. And that's our Northeast neighborhood, our Southeast neighborhood, Morse Road 161 area, the Northland community, Linden, Hilltop, Franklinton, and Near East. Thank you.
Prem, thank you.
Good morning, everyone. I'm Patti Callahan. I'm with the Central Ohio Area Agency on Aging. We're here in Columbus at 3776 South High Street. We serve Franklin County, all the surrounding counties, and Fayette County. We develop, fund, and provide services for older adults, and then we are also a starting point to help individuals who are living with some sort of disabling condition find the help they need. Primarily these, I'm referring to home and community-based services to help people live as independently as possible in the community. My role there, my title is caregiver advocate. I'm a social worker, and I talk to family caregivers about various care options. I help them navigate the systems that, sometimes very complex systems that they're going to be interacting with to get the very best care for their loved ones. And I provide general community assistance and help link people with the services they need in all of our 8 county service area. COAAA primarily provides, in terms of direct service, care management for a number of programs that provide home and community-based services, again, to help older adults and people living with disabling conditions continue to live in the community.
Thanks, Patti.
Again, David Huey, and I endorse the Jubilee Market. It's not only a grocery store, but it is there's a Milo's Deli in there, and it's really good. So try it if you haven't been there yet. It's really nice. Again, David Huey. I work for the Department of Neighborhoods, and people call us the Franklinton Pride Center, but we're really the West Side Pride Center because our office is in Franklinton, but our area includes the entire West Side. I oversee all the area commissions on the west side. That includes Franklinton, Hilltop, Southwest, Westland, a new commission called West Scioto, and a newly forming commission called Far West. I am the neighborhood liaison for the city. I act as a liaison between the administration and the communities. I go to an awful lot of meetings, civic associations, area commissions, and I manage city services for the West Side.
Thank you, David.
Good morning. I'm Joyce Shivers. I am the president and CEO of Gliding Community House. I'm also here to represent the Columbus Federation of Settlement Houses, so I am a member of that nonprofit organization as well. Gliding Community House is located in Franklinton, so very familiar with David and Lower Lights Christian Health Center, and I also endorse the Jubilee Food Market. It is a wonderful place. So if you're on the west side of town, please visit the Jubilee Market. It's a wonderful place. So the settlement houses throughout Columbus offer some basic services to communities. So we build our services around the needs within the community. We also are advocates for the residents of the community. So I sit on the Franklinton Area Commission so that I can be an advocate and a voice for the residents within Franklinton. I will get into some more details and specifics of the programs that we offer, but the majority of our services within Franklinton are focused on to serve the needs of the residents within Franklinton. There are several programs that we, as a settlement house, offer together and collaborate and partner to provide that service throughout all of Franklin County.
I appreciate that. So I really want to ask you what is happening with the population that you all are serving? So that your needs are their needs are so great that you exist. But before I do that, we have heard, Thomas, about the Jubilee Market now 3 times. So give us the address.
Yes. So the Jubilee Market and Cafe is located at 1160 West Broad Street. And of course, that's in Columbus. And we would love to see you there. Yes.
What are some of the markers? What
some
streets
of the markers. Yale Avenue, and it's just past Glenwood.
Okay.
Yes, it's if you know where Tommy's Diner is, just keep heading down west, and you will see us.
Okay, so I'm gonna stay with you just for a second. One of the things that resonated with me when you were talking is that you provide services for people without insurance.
Yes.
Can you talk a little bit about that?
Yes, absolutely. As I said, we do offer all of our services individuals and families with and without health insurance. So that means we are able to accept Medicare and Medicaid, as well as most commercial or private insurance plans. And individuals without health insurance may qualify for a sliding scale. However, no one is turned away for an inability to pay. So it doesn't matter if your slide is $10 or if you do not qualify for the slide and you pay the full price. No one is ever turned away for an inability to pay. And we also ensure that all of our patients know that we are able to work with them and set up a payment plan with them. However, as I said, it's in our mission, no one is ever turned away for the inability to pay.
And what kind of services do you offer there?
Yes, well, it ranges from primary care. So initially, someone becomes a primary care patient. And once they become a primary care patient, that means they establish us as their medical home or their family doctor. They would then have access to dental, to vision, to counseling services, and also our care management services additionally. Now, our grocery store is a service that we have. It is a nonprofit grocery store. You don't have to be a patient to shop at the store. You don't have to be at a certain income level to shop at the store. But we do also offer a slide at our grocery store for individuals 200% at the federal poverty level and below. That we also have a sliding scale for that as well.
Thank you very much.
Yes, and that's for our produce.
Excellent. I'm going to skip over you, Prem, just for a second. And I wanted to ask Patti, what does the aging population in the city of Columbus look like right now? And what are people in that aging population, what kind of services are they actually needing?
Sure. We're seeing a lot of folks who just need a little extra help to stay in their homes. That might be some help with some light housekeeping and some things like that. It might be that they need help with a bath or just somebody to stand by while they step in and out of the shower. I think some of the biggest needs that we're seeing, though, particularly for our lower income older adults, we have a lot of older adults who are food insecure. These days, we are in the midst of a housing crisis when it comes to senior housing. We don't have enough senior housing for low-income older adults. So that right now is the bulk of our calls. We've got waiting lists on most of the senior buildings. We do have some new development, but much of that is tax credit properties. And so for people living with Social Security or SSI income, that's a real challenge for them to find housing. They're pretty much priced out right now in the market.
Thank you. Prem, I'm wondering if you would identify the social determinants of health and what impact do these social determinants of health actually have on infant mortality?
Sure. So the 4 critical social determinants of health that we focus on at Celebrate One is housing, education, employment, and transportation. And as you can imagine, if a woman is unstably housed or recently evicted or homeless, she is experiencing a high dose of stress, which in turn affects her pregnancy. I think the underlying factor is the high stress levels that these women who don't have accessibility to things like transportation to get to their prenatal appointments, as in secure and safe housing in a safe neighborhood, as well as education. We talk a lot about female empowerment, and if you are pregnant, what are some of the questions you need to be asking at your first doctor's appointment? And so these are sort of the core social determinants of health, but we also talk about safety, and we have an alignment with all of our city departments, and they really play into strategic investments in our Celebrate One high priority neighborhoods. And we work with them to address some of the built environment and the challenges that a lot of our women in these neighborhoods live in, as well as many of our other partners like Columbus Public Health, to address some of these health inequities. So social determinants of health are very much health inequities that impact our target population, which are women of childbearing age in our Celebrate One neighborhoods.
What age of women do you serve?
14 to 44.
Okay. Thank you. David, as a liaison, what kind of issues do you tackle with the area commissions that you mentioned, and what's going on in those neighborhoods that you serve?
Just about everything. Any kind of city service, any kind of city development project. Area commissions are, if you don't know, are there to, they're advisory capacity to the city, mostly to advise us on zoning issues, but so they make recommendations to the city. They have influence but no power. Their recommendations can be taken by city council or not. But generally speaking, our council does pay attention to the recommendations of the area commissions. I wear a couple of hats, but as far as the Pride Center goes, we take any kind of city service request, so anything that does not get done kind of falls to us. So it can be as simple as a pothole to a drug house, prostitution, homeless camps, street paving, garbage didn't get picked up. We take all those complaints. So we are very busy. We have our core folks that are in the centers are from code enforcement, our CLOs from the Columbus Police Department. We have folks from Columbus Public Health, social workers, and we work with other departments pretty closely too. And we have key people in other departments that we call when we need help from, say, public service or utilities or recreation and parks. So we provide a wide variety of services, and I try to let our guys and girls know what the priorities of the community are, and let the commissions know what we're working on.
Can you give us an idea about what a typical commission might look like? Who makes that up, and what are their responsibilities?
All the commissions are a little bit different. They all have different bylaws, so they range from 7 members to 20 members. typically they involve a majority of people who live in the neighborhood. They all do that. All of them are the majority of people who are residents of the neighborhood. Franklinton, for example, has, I believe they have 8 appointed seats, which are typically folks like Joy from the main institutions in the neighborhood. Like Franklinton has Gladden, they have a representative from Mount Carmel, from our business association, from their library, but they're typically the community residents that are the biggest community leaders. We need, and combined with some folks that work in the neighborhood, they do a great job. They don't get enough credit. They're volunteers. They spend a whole lot of time advocating for their communities, and we actually, most of our commissions are not full, so we need more residents to be involved.
Okay, thank you. Joy? Settlement houses have been around for a really long time. And I remember reading about Hull House, which was the first settlement house in Chicago. What are the pressing needs of families right now that settlement houses see, and how are you addressing those?
Thank you. Let me just back up a little bit and mention the other settlement houses so you know who I'm talking to when I talk about the Columbus Federation of Settlement Houses. I'm going to refer to Columbus Federation of Settlement Houses from now on as CFS. It's a little easier for me to say than saying the whole word. So we have Godman Guild as a member of CFS as well, and they are in the Wyland Park area. And we have Central Community House. They are located in the near east side. We have Clintonville Beachwald, CRC, which is located obviously in Clintonville. And we also have St. Stephen's Community House, which is in the Linden area, and obviously Gladden Community House is in Franklinton. So we see a lot of pressing needs with our families and residents within our low-income neighborhoods. One of the most pressing needs right now for our low-income residents is housing. We are seeing neighborhoods being revitalized, which is a good thing. Okay, we want some of these rundown homes to be revitalized. Unfortunately, one of the end results of that can be that low-income residents are pushed out of their housing as the neighborhood is revitalized and the rents go up. So we are desperately working with the city, and we know there's a lot of action being taken around this lack of low-income housing. So we are very hopeful that it will get resolved and we'll see more low-income housing. Around that, if you don't have housing, oftentimes you will run into utility problems and needing assistance with that. You also have food insecurities. So the settlement houses have food pantries. We have rental assistance, utility assistance. We're also seeing an increased issue around seniors. And so many of our seniors are also facing the lack of housing. Many of them are fixed income, so they're on Social Security, and some of them are on the low range of being paid with Social Security. If you are receiving maybe $600 a month, and rents in Columbus are now $750, it's very, very difficult for them to be able to stay on their own and renting an apartment. So it's very important that they have the senior housing available to them on the fixed incomes. So we also, at Gladden and the other settlement houses, we provide food for those seniors. Some of that at Gladden we deliver because some of our seniors are homebound. So we're delivering them an emergency 3-day food supply once a month. So we're seeing, as you can imagine, with poverty on the rise in Franklin County, you can imagine that we are seeing a number of needs with our families and our seniors and individuals. There also is the issue of the opioid crisis, so we're seeing an increase of needs around that. So grandparents are raising their grandchildren as the parents are losing custody of their children, which brings about a whole different list of issues for those grandparents as they're trying to raise their grandchildren. So we are reaching out to them and also trying to provide some assistance to them. So financially, they're just taking on a burden of raising a child again, or children again. Yeah.
Thank you.
Yes.
So Joy mentioned a number of different crises, emergencies that families are experiencing that come to settlement houses. What are some of the real pressing issues, crises that you are noticing or experiencing with the people that you serve? So I'm wondering, Prem, because you are dealing with pregnant women between 14 and 44, what are some of the other crisis issues that women are bringing to your organization?
So I think it's related to these social determinants of health. I would say when in the state of pregnancy, it's a little more urgent. So they're operating with far more urgency due to a growing human being in their stomach. So I would say, transportation has been one of the biggest barriers for our target population. We currently have a project with Smart Columbus, the prenatal trip assistance pilot, and it's essentially to improve transportation to and from doctor's appointments. How do we make them efficient and easy on mom? A lot of times mom is towing 2 or 3 children in hand while waiting to be seen by the doctor. I will say housing is a huge issue, affordable housing at that, but also serving pregnant homeless women. So we do work with the Van Buren shelter to prioritize pregnant homeless women. We cannot do the work that we do without our partners. So certainly Smart Columbus, the city departments, as well as the Van Buren and Columbus CSB are valuable partners in our work. We also, I think overall in Ohio, the teen pregnancy rate is going down, but we very much want to keep it that way, trending downwards. So we work with our teen populations and our youth and to connect them to resources, prenatal supports. I will say we have a robust community connector corps. They are trained, certified community health workers in each of our 8 high priority neighborhoods who do a fabulous job in connecting these women from 14 to 44 to prenatal and social supports. We work very closely with community-based organizations such as St. Stephen's to advocate on our behalf, connect women, and share some of the resources that we're sharing out in the community. Trying to think of.
So you mentioned 8 areas around the city. I know you told us those in the beginning. Could you tell us again and maybe where they're located?
Sure. So again, the 8 neighborhoods are northeast, southeast, Morse Road 161, which is the Northland area, Linden, Hilltop, Franklinton, and Near East. So physically, the Celebrate One office is located in this building, 1111 East Broad. But we have many partners, working with community-based clinics, school-based clinics within each of these 8 high-priority neighborhoods. So in Linden, we work very closely with St. Stephen's. In Hilltop, we work closely with the Y, and we have a few current active interventions in each of these community-based organizations focusing on lowering or improving the social determinants of health. In Franklinton, we work with Fuel, and in Near East, Columbus Early Learning Center, they have an intervention. Currently, actually, their graduation is this evening around a mentorship program that's culturally competent and really informing women who are at high-risk pregnancies and in our high-risk neighborhoods and connecting them to social and prenatal supports.
Okay, thank you very much. What about you, Thomas? How are you all addressing some of the crisis issues that have come up?
Oh, of course.
If you can identify what some of the issues that people are presenting to you when they come for service.
Sure, sure. Well, as a medical facility, we have an opportunity to work with a range of clients with a variety of different chronic diseases. And right now, obesity and individuals being overweight and diabetes are fairly high. I read a stat yesterday from the community health assessment that 11% of adults have been told by a healthcare professional that they have diabetes, and about 65% of residents in Franklin County are either obese or overweight.
65%?
Yes, that's the stat that I believe that I read. And what we're also seeing, just in Franklinton alone, because we offer our services to 6 in neighborhoods in Columbus, but just in Franklinton alone, about a quarter of the population there is 200% below the federal poverty level. And we have noticed that a lot of concern in the area has been lack of access to just proper nutrition. So not too long ago, we made the decision that we as an organization, if we weren't able to get someone in to run a store or start a store, that we were just going to go ahead and do it. So we began the project for the Jubilee Market and Cafe, where we now have our dietitian we have on staff actually walking and touring clients through and giving them coupons for fresh fruit and fresh vegetables, just so we can educate our community on what is available to them, because it's really easy to say that someone has access to something, but unless you show them how available it actually is and how accessible it can be once they learn a little bit more about how they can address a lot of the health concerns they are experiencing if they gain access to proper nutrition, because as a comprehensive healthcare facility, we don't believe the body is compartmentalized, but one part of your body affects the other. And so we really work hard to ensure that when we are able to identify that someone is obese or overweight or they have diabetes, that we're able to sit down with them and talk them through how they can alleviate a lot of concerns they might have. And it's the same thing with women who are pregnant or the aging population. We really want to help address what they are currently facing and their current situation, so that they can not just improve, but keep on improving throughout their life, which is what we're really all trying to do.
Thank you. David, what are 3 major issues that the Pride Center is working on with some of the neighborhood commissions in your area?
I would say one of our biggest projects right now is, or has been over the past 6 months on the Hilltop. We've been working with the Wedgwood community, Wedgwood Apartments, if you don't know, or the Central Hilltop area. There's 600 or so units out there, mostly Somali population. Last year they had I think 12 homicides in the complex. So our department, the Department of Neighborhoods, and along with Columbus Police, have been having, through their area commission, through their Hilltop Safety Subcommittee, have been holding forums bi-monthly to educate the folks out there on things like how to interact with a police officer, how to report crime anonymously, basic life skills. So that, and I think it's been successful. We started by having maybe a dozen people at the meetings, and the last few we've had more than 100. And that's a lot of credit goes to the Wedgwood Middle School out there that's helped us a lot with getting folks to the table. We haven't had a homicide. It's June out there, so I think that's a success story. I'll echo what the other folks are saying. I think we're 56,000 units short on affordable housing. I don't like when people say low income because that scares everybody. But if you say low income, then commissions don't support it. Everybody knows we need affordable housing, but no commission wants it in their area. So that is a big problem right now that we're working on with all the different commissions. Folks seem to be opposed to, as soon as you say low income, folks are opposed to it. We are constantly dealing with, usually when there's an emergency, our code enforcement people come across it first. There's a lot of older adults, residents, that get their water turned off all the time. And the city considers that an emergency. And you also can't live in a house that does not have water. So what do we do with these people who are generally homeowners? No, they're not always homeowners. They're homeowners and renters. So every single case turns into an individual, with all different agencies involved, trying to figure out how to either get these folks' waters turned on or relocate them to a safe place. And right now, when people come to us and say, I'm in need of affordable housing, we don't have a resource for that. We don't have a place to direct folks. There's so many barriers to the folks we work with that are trying to find housing that it's, in a lot of cases, impossible. So those are some of the projects that we work on every day in the Pride Center.
Thank you. Thank you very much. Patti, I've just been watching you shake your head with, so I'm wondering if you can, you mentioned a number of issues that older people are dealing with. Is there one or two that are really pressing, that where you get many calls about?
Affordable housing is positively the top of the list. I can't emphasize enough what a crisis we are in, particularly for older adults, because and people who are living with some sort of disabling condition. The folks that are calling us are many times very frail and physically impaired, and so they're not really, the shelters are not equipped to meet their needs, and so we really don't necessarily always have a place for them unless we can perhaps transition them into a nursing home, at least temporarily, in terms of emergency housing. And then affordable housing, again, there are waiting lists everywhere, and it's a real challenge to find anything quickly. And a lot of folks, these are not individuals who are mismanaging money. It's been becoming more and more difficult to afford to live in our society on a fixed income. And so they're not blowing money necessarily. These are folks that don't have that kind of income, never made a lot of money, and have never been homeless previously in their lives. These are not chronically homeless people who may have had some history and had some challenges along the way. So they're utterly terrified when they call us, and we're terrified for them, and we don't always have good answers here. And so it's a real serious situation right now. We're also seeing a lot of financial exploitation with poverty issues, coming to the forefront with the opioid epidemic. We're seeing a lot of older adults victimized, and I've had some situations where I've had some older adults who actually lost their house. It was sold out from under them. Financial exploitation from family members over drug addiction issues. So we often are receiving a lot of calls around self-neglect, where a family member is desperately trying to intervene in some of these situations, whether the individual is just not able to care for themselves anymore, whether someone else is victimizing them, and they can't get any movement with the situation. So we work very closely and make reports to Adult Protective Services with the Franklin County Office on Aging.
Thank you. It was really informative, wasn't it? My goodness. I really thank you for that. So how does someone link up with your agency? Could you give us an idea about, so listening to everything that you all have said so far, if somebody wanted to get a hold of you, how would they do that? Thomas, do you want to?
Sure. Like most doctor's offices, you would just call to schedule an appointment. We are not an urgent care or a free healthcare clinic, so we like to make sure that all of our patients are seen in a timely manner and in a way that instills a lot of dignity in them. So we really want to make sure that people know that you have to call to schedule an appointment, and depending on the location, it can be from a week wait to about a month wait for your first primary care appointment. But you would just call our main line at 614-274-1455, and you can select option number 1, and it's option number 9 for individuals who prefer to receive any care they receive in Spanish.
Thank you very much.
So I would say our pregnancy hotline called Step 1 is by far the easiest resource you can connect someone to. That's 614-721-0009. And I left some of these cards over there at the resource table, so feel free to share and take to your own networks. And then I did fail to mention earlier that we have 3 primary goals, and that's reducing, and these are the 3 that we identified to really reduce infant mortality rate, and that's eliminating sleep-related deaths, preventing preterm births, and connecting the disconnected. So that connecting the disconnected is really what I shared around the social determinants of health. But another way to get engaged with our work is to become a safe sleep ambassador. And that's a program that we offer through Columbus Public Health, and they train on the ABCs of safe sleep. Safe sleep has been I would say, one of our successes thus far with our initiative. We were able to have a 45% reduction in sleep-related deaths just last year. And so encourage those around you and yourselves as well to, I think it's a 2-hour training for safe sleep practices. And that's, I would say, kind of our lowest hanging fruit. So please help us there. Our Step 1 hotline, and then our various community partners that provide direct services, such as Columbus Public Health around smoking cessation programs that we know impact prematurity, as well as St. Stephen's. They have an app called Celebrate Linden, and that's really for that social cohesion, but they have various services that they offer in the neighborhoods, businesses, for families, for moms, for pregnant women. And then around, I would say, as well as our community-based organizations that I mentioned in our west side. And then I did neglect one very important neighborhood and huge partner is the south side community. We do work really closely in 43207 and 43206, and we work closely with Community Development for All People, and they're doing wonderful and great things to support us. We also, throughout the year, will host baby showers and first birthdays in each of our high-priority neighborhoods. So you can find more about that in our website or social media accounts and our Facebook page. Encourage those you know who may be pregnant to attend those. There are various resources, and not to mention fun giveaways and baby shower gifts and first birthday resources as well.
Thank you very much. Patty?
All you would need to do is call our main number at the Central Ohio Area Agency on Aging, 614-645-7250. We have both information and assistance staff who handle general inquiries and provide support to family caregivers who are looking for information on services to help their loved ones in the home. And then we also have screening staff who actually will engage the caller if it looks like the individual really knows what they need. They'll engage them in a short questionnaire and get some information so that they know which program is most appropriate to direct them to. And so we're the actual intake point for the state Medicaid waiver programs in our area for Passport and the Ohio Home Care Waiver. These are Medicaid programs that allow individuals to stay in their homes with the help they need who would otherwise need nursing home care. So they meet the Medicaid financial eligibility, which is long-term care Medicaid, very different criteria than the Medicaid for just health care. And so we have about 200 care managers at our agency that do the care management for those programs as well. They're both nurses and social workers that do that. So we might be directing an individual to those programs and are the starting point for those. We're also the starting point for the assisted living waiver, which is Medicaid dollars that help pay for assisted living. This is very limited. But there is this ability to have some Medicaid assistance for assisted living. Then if someone has questions about Medicare, we have Medicare specialists on staff as well. So we will direct those questions to our Medicare staff there, especially during open enrollment. We can help people with getting the information they need to choose their plans and that sort of thing.
Thanks, Patti. David?
In addition, we have 5 Pride Centers throughout the city, and I'll try to go through generally where everything is. The West Side Center is right west of the Jubilee Market at North Yale and West Broad Street. It's 1186 West Broad. Any of the Pride Centers you can walk in. You can also find us on columbus.gov under the Department of Neighborhoods. You can find all our direct dials for the Pride Center managers and our locations. Our South Pride Center is in the Reeb Center. I'm sure most all of you are familiar with that. Our North Center is 248 East 11th Avenue in the campus area. Our Near East Center is just down the street at 1393 East Broad. And we have a Far East Pride Center, which is 2500 Park Crescent Drive, which nobody knows where that is, but it's roughly at Bryce Road and I-70 near the old J.C. outlet store. So you can find all of our information on columbus.gov. You can also call 311. We see all those complaints or if it's a lot of things are difficult to. When issues get more complicated, it's hard to find a category in 311. So I would suggest you calling your Pride Center person that's in your area if you have something that you'd like to discuss a little more than you can put in 311.
Thank you, David. Joy?
For Gladden Community House, you can call area code 614-227-1600 or gladdenhouse.org. For Clintonville Beachwald, it's clintonvillecrc.org. Central Community House, it's cchouse.org. St. Stephen's Community House, it's ststevens.ch.org. Or for Godman Guild, it's godmanguild.org.
Thank you. Can people volunteer with you? We do know about the Safe Sleep Ambassadors. And what kind of volunteering opportunities do you offer? Do you want to go, Joy? Mm-hmm.
Yeah, we have a wide range of volunteer opportunities. We probably have about 2,000 volunteers a year. So anywhere from our team sports program, so they're volunteering to referee or to coach our children. In our year-round team sports program, we see about 500 children in that program. So it's pretty exciting to have volunteers that want to come out and help children learn to be team players in sports activities. We also have volunteer opportunities at our food pantry. People come in and help stock the shelves, as well as pick up the day-old breads and bakery items from Kroger for our food pantry. Or they may want to deliver food to our homebound seniors or disabled residents. We also have different volunteer opportunities throughout the year. We have a Halloween party for Franklinton community, and we see about 400 children in our gymnasium. So you can come out and help have little game activities in our gymnasium for the children to partake in and hand out some free candy. We also have fresh produce days throughout the summer that we look for volunteers to help with our fresh produce days. We have preschool graduation, which is very exciting if you like little ones and watch them perform during their graduation, and you can volunteer to help set up and clean up after that graduation. And then we just have some general volunteer activities that go on throughout the year that some companies want to volunteer and have a day of volunteer activity where they come out and they paint rooms for us, or they do some weeding around the building. We also have volunteers that come out and do projects in our senior homes. So they go to the seniors' home and maybe do some painting for them or yard work for them as well. So we have a wide range of volunteer activities at Gladden Community House. So if you're interested, as I said, you can call us at 614-227-1600.
Thank you.
We do not really have volunteer in the Pride Centers. There are a few Pride Centers that employ seniors. What's the senior agency?
Senior Community Services Employment Program?
No.
Measure Services?
ARP, yes.
Same.
That do have some ARP volunteers that help with, office duties and answering the phone. We don't have any at the west side, but a few of the other Pride Centers do that, and we have pretty limited volunteer opportunities.
What about with the area commissions?
Well, the area commissions are all volunteers, so I'm kind of the neighborhood liaisons, Pride Center managers are kind of their support system. We do a lot of technical and administrative support for the commissions, but no, if you want to be an area commissioner, you can. There's spots for you. Almost every commission in the city could use some more commissioners. So.
Okay, that's great. Thank you.
We have a COAAA, a volunteer guardian program, and this is a program that provides someone as a surrogate decision maker for individuals who are living in a protective setting of some sort, such as a nursing home or assisted living, who really have no one and are really not able to make decisions around their medical treatment and things like that. And so these guardians are appointed through the probate court system. They are guardians of the person only. They do not manage finances in any way. But they also, become family for these individuals and really enhance their quality of life. And there's someone checking in on them and making sure that, their needs are being met and perhaps taking them on outings and things like that. So we are increasingly needing volunteers in this role. There are many, many people out there that have no one. That's increasingly the case with smaller families and families more geographically dispersed or whatever. So this is a big need, and we would be delighted to have your help with that.
Thank you.
So I mentioned our Safe Sleep Ambassador program. We are currently building a volunteer corps, but until then, we encourage you all and others in the community to become Safe Sleep Ambassadors. We were able to train over 500 last year. Our goal this year is 725. And then also just being a community advocate, spreading the word on step one and sharing that pregnancy hotline number, as well as referring folks to Columbus Public Health and to obtain either a low-cost car seat or a free crib or pack and play. And just, I would say, referring folks also to our website, celebrate1.info, for more information and if they need resources around either preconception health, prenatal, or postpartum.
Thanks.
We do have a variety of volunteer positions that range from office support. So we do use volunteers to assist us with a variety of different marketing efforts in terms of organizing things, folding things, walking door to door to get the word out about the various programs we have. More specifically for the Jubilee Market and Cafe, we're looking for volunteers to help us canvass. We also are looking for more volunteers to serve as greeters at the cafe or in our waiting room lobbies. So if you know anyone interested in that, we're looking for very enthusiastic people that would be very excited to make sure that someone tries some of the fresh samples we have in the area of fruit and yogurt and vegetables. And you can learn more about all of our volunteer opportunities at llchc.org/volunteers.
Thank you. Before we go on, I just want to welcome Dr. Jindal. He is a commissioner with the Columbus Community Relations Commission, and just the best ever, Dr. Jindal. I would love to hear a success story. How you are, because our theme is let's make a difference. So share some success stories about how you're making that difference. Anybody can go.
I'll start. So I mentioned our community health workers. Essentially, this is not only boots on the ground. These women are just, and I would say men, we have a couple men community health workers, are not only our boots on the ground to connect people to resources, but it's also a pipeline. You know, how can we, these folks are from the neighborhood, they're very familiar with the resource landscape of the neighborhood, and how do we also build an employment opportunity for them after the program? And so typically it's a one-year commitment with Celebrate One, but we very much work with our partners to encourage full-time employment for them afterwards. So we were actually able to bring at Celebrate One, we currently have brought in 3 former community connectors is now part of our staff, and they know their communities more than anyone we know, and so they are trusted and very much help the work, carry out our work now as full-time Celebrate One staff. I will also say we have various interventions and programs that we like to learn from and then scale up. So we had a intervention on the south side called Care Homes. We were working with Community Development for All People to house pregnant women to prevent prematurity. We wanted to make the tie of, you know, if you house a woman in a safe and stable home, it's less likely they're to have a preterm birth and to improve birth outcomes. And so all 10 women delivered full term, and so that was a huge success story, and we were able to take that model and scale it up. We applied for a grant through Ohio Housing Finance Agency, and the CareSource Foundation, so we received a little over $1 million to help 100 women. And so our goal this year will begin a launch in July, but is to stably house 50 women, and then to make sure after this intervention they continue in some sort of capacity in safe and stable housing.
Great.
I would say that, you know, we are care managing about 8,000 older adults who through our programs, who would otherwise need nursing home care. And we know that as we age and we need some extra help, that most of us would still like to stay in our own homes. That's where we thrive. That's where we do best. That's our safe place. And so we're able to do that in their home and help them stay in their homes safely. It is definitely, there are some challenges across the board in terms of having the direct care staff. I think you've probably seen the recent articles in the Dispatch addressing that issue. And we are trying to look for creative ways to address that. But a lot of this is funded under Medicaid, and so, you know, unless there are increases, it's difficult sometimes to retain staff. But this is huge for these people who would otherwise need nursing home care. We also provide care transition, or transition coordination, I should say, for individuals who are living in a nursing home under a program called Home Choice. This is provided for under federal funding. Money follows the person, and the idea is to help someone in a care facility transition back to the community. Often when someone does move to a care facility and they're there for an extended period, they do lose their housing. And then it becomes difficult when their income goes to the facility, if they're there with Medicaid as the payer, to have the first month's rent and deposit to move back home and to have some help finding a place to live in the community and getting a household set up again. And so that's what our transition coordinators do. And so we're able to help a lot of people move back to the community and continue to live independently in the community with the services they need.
Thank you.
You go ahead. All right. I have so many success stories, but I just have to share a recent one with you that really has warmed my heart greatly. There was a young man that came to us several years ago. He's about 8 years old, and he started attending our after-school program. and he had some pretty serious behavioral, emotional, and some educational challenges. He struggled with the word no, and he did not interact well with other children. He would have a meltdown to the point that we would have to separate him and put him in a room and sit and talk with him and calm him down. And we had to teach him anger management. And we didn't give up on him. We did not give up on him. And we knew he had challenges at home, so we met with his parents and we wrapped our services around his parents as well, as far as getting food into the home, helping with some stable employment in the home, some rental assistance, utility assistance. We found out he had a younger sister, so we got her involved in our after-school program as well. He became very active in our team sports program, so after we finished with him in the after-school programming, making sure he was being successful in school, we got him engaged in team sport activities, so he wasn't going back home immediately. So he spent a lot of time with us. In the summertime, he was in our summer learning camp program, so he probably spent more time with us than he did at home. So we became his second family. And I have to say that I'm very proud, at the age of 18 this year, he graduated high school. Yes. And because his family didn't have the money to pay for the cap and gown and to pay for him to graduate, we did. And not only did we do that, we showed up for his graduation. And we had a graduation party at Gladden Community House in our gymnasium for him. So I would say that's our most recent success story. Thank you.
Great story.
I also have a number of things I could talk about, but since we're talking about affordable housing a lot this morning, this afternoon, just so you guys might get some perspective on how new affordable housing works in the neighborhoods. We're in the middle of completing a project on Wheatland Avenue in the Hilltop area that was called low-income housing. And you have to understand, in our challenged neighborhoods, a lot of the community leadership, when you say low-income housing, they're like, we already have low-income housing. We don't need more low-income housing. And that's kind of the knee-jerk reaction of the commissions, not Franklinton. But Franklinton's great. But there was much opposition, not only from commissioners, but from residents, people that lived in the area. It was to be a 62-unit senior building and another 60-unit family building that was going to be built on city property just behind the West Side Health Center there on West Broad. We probably went through 6 or 8 months of commission meetings with the developer, presenting plans, talking about the median income. The median income for these places was quite a bit higher than the median income for the area that surrounded it. But they still called it affordable low income. But most of these retirees did have incomes, and it was probably going to be a pretty quiet place. They changed the design of the place several times to make it fit in with the community. The senior part finally did pass the commission, and it was immediately full. It's full now. It's complete. The second phase of the development was so controversial because they did not like the suburban nature of the building. The commission ended up voting to a 6-6 tie on that facility. And the next step in the process is the developer goes to the development commission, who instructed the developer to go back to the community until they were happy with the design. And we probably went through another 2 months of design changes where they reduced the number of units, which was a concern. And built townhomes along, I think 4-unit townhomes on Wheatland that look very much like the houses that were across the street. So I think that's the way affordable housing development needs to happen. I think it's a really good example of how the community comes to understand that just because it's affordable doesn't mean it's bad people. And the type of developer that we need that is really willing to bend over backwards to help the community and provide 24-hour on-site management and be very responsive to any of the complaints in the community. I think it was a win-win, and we should duplicate it in other neighborhoods.
Thanks, David. Thomas?
Oh, I have two short ones. One, my wife and I are actually both medical patients at Lower Les Christian Health Center, in addition to myself being an employee there. And before I was employed, and we began to receive our care from there, my wife had an asthma attack about every other year. She was in the ER. It was very, very bad. But since she began to go to lower lights and received comprehensive health care, not just focusing on one facet, she hasn't had an asthma attack since, and I really attribute that to the level of care and this attention that she's been able to receive. So just to give you an idea of the kind of care that they offer, my wife and I are both very, very, very comfortable just receiving all of our care from dental, primary care, just the counseling. We are very pleased with the care that we've received. But I recently heard a story from earlier in the year about a gentleman who was in our MAT program. That stands for Medicated Assisted Treatment Program. It is for individuals who are struggling with opiate use. And he was also having issues finding housing. So housing I'm pretty sure housing has come up from every single one of us up here. And our care management team worked with him and didn't give up with him. He was in transition from homeless camp to homeless camp for several months, and then eventually he did get approved for housing. Our team did not give up and made sure that he was approved. He is also still active in the MAT program, and he recently told this story to the entire care management team and said, "It's because of my dream team that I've been able to recover, that I've been able to grow, that I've been able to become the person I am today." And he was so just incredibly grateful. And it was a sobering reminder that it wasn't just one person on our team, in the same way it wasn't just one organization that helped this man in his recovery, because there were other agencies that were working with him, housing just being one example. So it's just a reminder that it is agencies like all of us who are here today that make stories like we're hearing up here even a possibility. So thank you all for being here. Thank you.
Thank you, Thomas. So I have a couple more questions for the panel, but I want to just stop and see if there are questions from you that you would like to ask of the panel. Short questions? Yeah, just, I'll ask you to come right here. All right. Ma'am, if you'd like to come here. So I'm going to ask that they be short. All right? Okay. Yeah, just come right over here.
All right, first of all, thank you guys for all you do. I work at the state level as a constituent liaison, and I work with victims. So I have victims that always are not victims that are low income. So I get moderate income that because of their victimizations need assistance. I did hear you speak about you provide assistance with utility bills. So can you tell me if there's any assistance or if you know any programs to help those people that are not low income? That's it.
Yeah, I'm trying to think about not low income. All right.
You just jumped the panel?
Yeah, you just stumped the panel.
Anyone else have an answer for us?
I think it's a matter of
Yeah, at Gladden Community House, we do have our own financial assistance fund, so we would be willing to work with anyone that is not low income that comes in and may have some emergent needs. Our other program is run through the Breathing Association, and they receive the federal funding for the utility assistance, so that is income-based. But we do have our own small pot of money that we possibly could assist someone if they live on the west side. Okay.
I can add to that a little bit. I'd also say you might work with some of our development associations, Fuel in Franklinton, Homes on the Hill, on the Hilltop, have some housing opportunities for not necessarily low-income folks.
Community resources are pretty limited for that group of folks. You know, we'll be happy to, if somebody wants to call us, try to run through our little, you know, list of potentials. Often we refer to like medical social service agencies, that sort of thing. If there's a, you know, for example, maybe a cancer diagnosis or some social service agency specific to a medical condition. So we just need some information about the situation to know where to send someone. But, you know, for that group, there is very limited help out there.
So I do have another answer for you. Many of the churches in the communities, no? You're shaking your head no? Okay, well, it's a thought. A lot of the churches in various communities, even Westerville has a church. Right, that is offering a lot of services to people. So I would, you know, also check in the communities, churches that may have some resources.
What changes her scope of help was victim. The word
Right.
victim changes her.
We can't hear you.
Okay.
So,
Okay.
but can we?
Okay.
I just want to know quickly what educational services and legal services that some of you may offer for the groups that you're working with.
So educational services we have for our after-school program. We are providing homework help and tutoring for our young children. And for the adults, we work with Godman Guild, and they provide a GED program as well as a workforce development program through Godman Guild. And some of the other settlement houses are also providing after-school programs with homework help and tutoring as well. And they also, if they don't have their own workforce development program, they are referring to Godman Guild.
We don't provide direct legal services, but we have a relationship with Legal Aid Society. One of their attorneys regularly attends our staff meetings. We often refer people there who are having landlord-tenant issues or eviction problems. The Franklinton Board of Trade also provides once a month. They have an attorney that works in the neighborhood that will consult with people for free. That's about the extent of legal services, yeah.
COAAA provides a whole range of community education programs. We have a 8 workshop series for family caregivers that we developed. And that curriculum, the handouts from that are actually back on the table in a book that we produce with sponsorship from Ohio Health called The Caregiver's Toolbox, a guide for independent living. We do also provide education to people who are new to Medicare. We have regular workshops at the office for those individuals, and we provide professional education to the community for nurses, social workers, and nursing home administrators. We also offer some evidence-based classes, or we train the trainers for that, for chronic disease self-management. These are 6-week courses, and then also for matter of balance for falls prevention.
We have a couple of education classes out in the community, specifically on the west side in Hilltop and Franklinton, providing financial literacy courses. It's a modification of the Bridges Out of Poverty curriculum. We also have a partnership with 7 clinics in our communities, and they essentially identify women who may need legal help and refer pregnant women to Legal Aid Society. So I'm happy to share those clinics with you offline.
Next question. I'm Julie Hart with Ohio Dominican University, and I'm with the Social and Behavioral Science Division. So social workers, sociology, criminal justice. We're always looking for good internships, not necessarily paid, but well organized with supervision. Do I just assume that you would plug them into your volunteer tracks that you already spoke about, or do you have organized internships with people ready to supervise for a whole semester?
I'm not able to speak to them in detail, but if you would like to afterward, I can go ahead and give you my card with the information of the individual who takes care of the social work internships.
I'm sorry. No, go ahead.
We do as well celebrate one, and I'm happy to talk a little bit more offline. I'll share my card. Depending on the interest and project, we can make that happen.
And yes, we also have internship opportunities at COAAA. They are organized and placed with our case managers.
We also have internships at Gladden Community House. We work with Capital University, Columbus State University, as well as Ohio State University. So we'd be welcome Dominican as well. So.
Thomas, this is for you. I really want to give a shout out to Lower Lights. Great people. I've been to some sort of training there, leadership, urban leadership training or something. I wonder if you could say a couple things about some of the other things that Lower Lights does. Don't they have like a recovery housing or something like that, children's programs, all kinds of things? I was at a little seminar about serving people of Appalachian background, which was just super interesting. It's a cultural group that, we often don't understand. So I just wondered if you could say a couple.
Yes, so what, I did not get her name, but I believe Peggy? Nikki. I believe what Nikki is referring to is a sister organization called Lower Lights Ministries. There is the Lower Lights community in Franklinton. There's Lower Lights Christian Health Center, there's Lower Lights Community Church of a Nazarene, and then there's Lower Lights Ministries. They are 3 separate non-profits, but we certainly love and support all the work that Lower Lights Ministries does. And if you have any questions about the services they offer specifically, I would be able to connect you with their social workers and also their program coordinators. Their address is lowerlights.org if you would like to learn more about Lower Lights Ministries. Yes. Thank you.
Thank you. My name is Tom Leach. I'm the director for HUD in Columbus. And we do a lot of federal things that have a lot of impact at the local level. For example, about 1 in 5 families in Ohio has a place to call home because of one of our programs. And a lot of tens of millions of dollars come to the city of Columbus and Franklin County, and a lot of it comes to you guys through those local governments. What I wanted to say is, although we have the programs and the dollars, the real impact is at your level. It's the one-on-one and the small teams that make a difference in everyone's lives. So I just want to say thank you for that. I also want to mention one other thing, that sometimes you're not talking about just low-income people, but everybody who needs help. And HUD has resources for helping to avoid foreclosure, how to file fair housing complaints. This is regardless of race or income, is strictly people in need. So I wanted to specifically thank you for all your work on that.
My name's Natalie Young, and being an outreach director, victimization is a huge problem. When you're dealing with the most vulnerable, which would be women and children, we have to have backup when we're going to court, when we're advocating, when we're finding housing, even with the attorneys. When you say victimization or victim, it's the same thing as saying homeless, or you get the same stereotype. So what are you doing to collaborate the protection around them that would create an atmosphere for more advocacy, more assistance, more funding? Like she said, some victims are not low income, but they still need the same assistance. Is there any umbrella, is there a blanket, is there anything we can do to help them more come out of that situation?
They're all looking at me. So let me just talk a little bit about what we do at Gladden. So anyone can show up at Gladden Community House, and we can talk to them based on what their needs are. And if they're a victim, we do have resources for them. So over at Mount Carmel West, we work with a trauma center, so we can connect them with a trauma center. If they want refer for other counseling, we can do that as well. But we start where they're at, okay? And we based any service that we have or their needs and link them to that service. So at Gladden Community House, people can walk in and they feel as though that's an extension of their home and that they'll be accepted, so they're not being judged on who they are. If they just need to come in and use a phone, they can do that. If they just need to come in and use the restroom, they can do that. It's a hot day and they want to sit in our lobby for a while, they can do that. Okay? We're not there to judge them. We're there to help them. So we also work with the Community Shelter Board, and we are the hub of the prevention of family homelessness. So the Community Shelter Board is putting more and more money into prevention services. So we are now have become that hub, and we're trying to work further upstream with families to make sure that they don't become homeless. It costs a lot more money to get them out of the shelters into housing. So if we can keep them into their housing, we're much better off for everyone. It's not a fun experience. That's another way to victimize children, is putting them into shelter, right? We don't want to do that. So we're trying to keep them in their housing. I could go on and on, but I won't. So I don't know if anyone else wants to say anything.
I would add that the city has, out of our Columbus Public Health Department, a newer group called Columbus Care Coalition, which Kim Stans can raise your hand, Kim. Is well, he sort of coordinates that group and knows a lot more about it than I do. But I think. Kim, you can tell me if I'm wrong, that they're helping with folks that are victims of trauma and providing services for folks that run into problems in the community.
I was going to quickly mention certainly the Care Coalition through Columbus Public Health, but also our community health workers. They're very much our one-on-one support for moms, whether it's making that call to shelter, whether it's attending their first prenatal appointment with mom, or assisting them in going on and using the bus line and figuring out and how that works.
Good afternoon. My name is Heather, and I'm here representing Secure Embrace Senior Care. We provide non-medical in-home assistance to seniors, but as of right now, we are only private pay, so they're paying out of their own pockets for our services. And the theme for today has been low income, affordable options. And I guess my question is directed to you, Patti, but also Joy and David. What would you suggest or recommend for a company like mine to be able to service the low-income population, whether it's through grants or through Medicaid? How can we service that population?
Get in touch with our agency. That you could potentially become a provider for some of the waiver programs and become a contractor that way. The Franklin County Office on Aging that administers Franklin County Senior Options, which is funded under a property tax levy in the county. Also, would potentially be an entity that you could contract with to provide services. We do field, and we have talked mostly about folks with more limited resources today. We field many calls at the agency from families primarily caregivers who are, even though they may have financial resources, really don't know where to start in finding help for a loved one. So we did put together a guide. Actually, we have several guides, topical guides on our website. One of them is a guide to private home care, because we know some individuals will never have eligibility for the government-funded programs. So we're not able to list all of the home care providers in there, but we do give a smattering of our passport providers in there for people to get started and to kind of help them understand what kind of services are out there, how are they paid for, and then kind of help them understand how to find quality help.
Hello, I work for an organization called the Nature Conservancy, and we're trying to focus or figure out where we can play a role in Central Ohio on environmental equity. And so my question is, in your, whether it's conversations, your work, planning, how much does air and water quality factor in? I know when you're thinking about shelter and food and the most essential parts of life, does the environment factor in anywhere? And you can, in the interest of time, you can answer 0, never, 5, always. Thanks.
I'm not going to put a number by it, but we certainly, in our after-school program, are educating our children about the environment. We take them on field trips out to different parks, et cetera, and we're teaching them about nature and the environment, the impact that we have on it. So we also work with the Innovator Lab over at OSU, and they're doing a lot of different projects around educating children on the environment. But also we work with Mount Carmel Healthy Living Center, and they are doing a lot of different work and working with individuals around health and healthy environment as well.
Anybody else? All right. So we still had a few more people in line. I think we found out today that our panelists are really knowledgeable, aren't they? Great job, and just want to thank you. So I guess I want to say that if you really care and you really want to make a difference, I think we heard today that there are many ways of giving your time and sharing your resources to help not just those of us who are in need, but all of us in the city in a really special way. So I just want to thank you so very much. I encourage you to come up to the panel after we're through. Give them your cards, get their cards, share as much information as possible, ask all your questions. And we look forward to seeing you on July 19th. Neighborhood violence. Let's make a difference in our community. So we look forward to seeing you then, and thank you very much for being with us.